Today we are going to see about alcohol addiction. So we have come across a lot of people, a lot of literature about alcohol and alcohol addiction. So let me give an overview of what happens to a person who's taking excessive of alcohol. So first, how do we know that we are addicted to alcohol? So there are certain markers which as an individual you can find out, or as a family member you can find out, thinking that this person is going to a level of addiction. So what are the few things? The first is the amount of or the quantity of alcohol which the person consumes is slowly increased. A person who started with maybe 70 ml to 100 ml of alcohol is slowly increasing the intake of alcohol to 250, 500 ml, then that is a red flag that he is going into the path of addiction. The frequency of alcohol intake, whether the number of times he takes alcohol has increased from once a week or once a month to alternate days or 2 to 3 times a week, and then finally every day, then that's another indication that he is going to the path of addiction. If he develops tolerance, that is, the amount of alcohol which he has been consuming is no longer giving the same effect or relaxation or sleep which it used to provide before, it indirectly indicates that his body and brain is getting used to the level of alcohol and it is not causing the effect, which means he has to go in for higher amounts of alcohol. And not taking alcohol is causing the person uncomfortable, is making him uncomfortable, it is causing sleep disturbance, is causing irritability or restlessness. So this also amounts to some amount of withdrawal because the person is not taking a particular amount of alcohol. So all these are indicators which an individual can by himself realize that he is slowly getting addicted to alcohol. If the individual doesn't realize, then maybe his spouse, his partner, his friends or other people around him can also see this happening, and maybe they have to warn him that he is going beyond a certain limit and somewhere alcohol is taking control of him. So what is actually happening to this person? So if a person A has increased his amount of alcohol intake, has increased the frequency of alcohol intake, and is having problem if he doesn't take a particular amount of alcohol, then definitely it means that he's going down the path of addiction. So how do we prevent these people from making this happen? Before that, we need to understand what happens in addiction. So there's an addiction pathway in everyone's brain. That is, it is a neural pathway which gets activated because of continuous intake of alcohol, or for that matter, any substance. So there is a reward pathway which also gets activated. So what happens when the person is anxious or having sleep disturbance or is out of any stress, professional or personal, he starts consuming alcohol. So then he feels relaxed, which is assumed as a reward. So every time he feels stressed, he feels anxious, he needs a reward, which is alcohol. So slowly he goes down the reward pathway wherein he's satisfied by taking alcohol and he feels less stressed on taking alcohol. So as days pass by, what happens is he only feels happy when he takes alcohol. He moves from the point where he takes alcohol to reduce his stress. He moves to the second point where he can be stressed only on taking alcohol, which means normally he cannot enjoy himself. So this happens because of certain neurochemical imbalance which is happening in the brain. So there are certain circuits and certain areas in the brain which are stimulated, and this circuit keeps reinforcing every day because the alcohol is being consumed every day. So it is like our memories. When a particular memory is being brought about every day, it becomes strong. So that is how our childhood memories, what we learn, like for example, our alphabets, numbers are very strong because we've been using it from a very young age. So the repetitiveness of a particular act would make that particular neural circuits very strong. So a person who's consuming alcohol regularly in a similar manner, those neural pathways of the brain become very strong and they are attached to the reward pathway. So what happens in the long run is all the emotional cues attached to alcohol. For example, where he drinks, with whom he drinks, what are the triggers which increase his craving for taking alcohol, what is the time which he takes alcohol, all these become fixed. And all these become cues which enable or make the person crave for alcohol. So when all these emotional cues are being addressed, only then this particular person can stop taking alcohol. So we've seen what it takes, what are the symptoms which indicate that the person is addicted to alcohol. We just saw how the neural and the reward pathways work for a person, who's taking alcohol, and how emotional cues act as, act in triggering memories and triggering craving for alcohol. So now, what do we actually do if we need to come out of this behavior? So the first thing is, somewhere down the line, the person needs to have some motivation to stop alcohol. Because even to treat this person or even to help this person to come out of alcohol, it's not completely possible without the person's consent. For example, if the patient comes to me and says that I really want to leave alcohol, I'm not able to do it myself, can you please help me? Yeah, definitely we can help him about as to what he can do, what are the behavioral changes he can do, what is the treatment we can give him, how he can try to come out of this. But if the person is brought forcefully by someone and he has no motivation to quit alcohol, we can still help him, but the chances of relapse are higher in such a person where the motivation is completely less. So the motivation or the locus for leaving alcohol should be internal. That is, the person should know why he is leaving alcohol and for the right reasons. It shouldn't be because my wife is telling me or my family is telling me or someone else is telling me to quit, so I want to leave. No. It should be because the person knows that alcohol is causing damage to his body physically, and alcohol is causing damage to his mental health as well, which is affecting his professional and personal life. Only when this thinking comes to the person, the motivation is, he is motivated enough to actually tread this path of de-addiction or tread this path of trying to quit alcohol. So, what are the problems that can happen once the person starts to quit alcohol? The first thing can be he can have a lot of withdrawal symptoms. Like, main thing would be sleep disturbance, because most of them would be consuming alcohol for proper sleep. So the moment the alcohol is not there, they would have some disturbance in their sleep. The second could be they could have some bodily symptoms like tremors or restlessness or feeling irritable, mood swings. So all this can happen for a person who's been taking alcohol regularly. So the sleep and these mood swings, tremors, irritability, these all can be managed with medications. Whereas the core symptom of managing the craving, this can also happen with the help of medications which act on various brain centers, which bring about the neurochemical changes to reduce the craving. At the same time, along with medications, there need to be a lot of behavioral changes from the patient and the family side, which can enable him to remain abstinent from alcohol. So what are some of the behavioral changes? So the first thing, as I already told you, the need to lessen the emotional cues or the need to erase the emotional cues. So they must stop triggering, or they must stop reinforcing those memories, wherein they must stop going to the places where they used to go to take alcohol. They must replace the time which that person spent taking alcohol with another activity which he or she is interested in. It could be physical training, it could be any other hobby which should replace the time which was spent taking alcohol. And he should not meet people with whom he frequently drinks together. As in, if they are close friends, he can meet them, but meet them in the morning or at a particular time wherein he cannot go along with them to take alcohol. So, because these are all emotional cues which will immediately bring back memories of alcohol and will immediately trigger the craving for alcohol. So, these are some of the behavioral changes he has to do. Secondly, increase in physical activity, proper sleep, for which initially we can give him medications, and slowly as his sleep is getting better, we can taper off the medications. We need to give them vitamin supplements because the food intake and digestion would be poor for a person who's taking too much of alcohol. So definitely we need to supplement him with vitamins. So even for the tremors and the restlessness, we can initially treat him with medication, but slowly when the acute symptoms are reducing, we can taper off the medications. So what is left is the craving for alcohol. So one is the behavioral problem, behavioral changes which he can do. Second is to remain motivated and to meet people and talk to people who have already quit alcohol successfully. And at the same time, the family should act as a emotional support, providing the person and understanding the person that he's trying to do something on his own to quit a particular habit, and as a family they should encourage him to do so, and they must not be bringing back the past and talking about the many times when he failed to quit and all that, which can again push back the person into going back to alcohol. Any stress or any mood swings or depression or any other event which happens during this time, that should also be immediately addressed, because another important reason for relapse is depressive symptoms or mood swings. And the most important thing is boredom. A person who wants to quit a particular substance, he cannot be allowed to sit simply throughout the day. The entire day of the person has to be scheduled. His activities through the day needs to be spaced. It is better he gets involved or rejoins in a particular work, and his entire day is occupied with some activity or the other, and most of the time he is not alone. Because another important reason for relapse of patients taking alcohol is boredom. So when the person is bored, automatically the memories of alcohol and the craving for alcohol trigger. In spite of all this, still it does happen that out of the blue the person has a craving for alcohol. So at that time, what has to be done? At that time, he can take 1 entire liter bottle of water and continuously drink it. Drink a half or 3/4 liter of water. So that time what happens, he has this feeling of being full and the craving will reduce. Another thing is, if it is nearing lunchtime or dinner time, he can immediately eat his lunch or his dinner up to his stomach's full. This will also reduce the craving. So multiple issues are there in order to bring out a person from this addiction. So be it psychological, familial, stress-related issues, along with that medical treatment. All this together with some amount of motivation from the patient and a good family support can definitely help you to quit alcohol. Thank you.